Bob and Brad, the two most famous physical therapists on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
You're the real most famous physical therapist on the internet.
In our opinion, of course, Bob.
Plantar fasciitis, plantar fasciitis, how to heal with massage. That's the topic of today.
And this is kind of attractive because if you can heal something through massage, usually massage feels pretty good. We've got a good thing going here, I think.
That's right. We're going to show you a couple of ways to do that too. Mm-hmm. So plantar fascia, the reason I said plantar fascia because that's what is affected. Mm-hmm. There is 3 thick flat bands that form the arch of your foot. Now, I actually have a pretty high arch. You can actually see the bands here.
Yeah, you certainly can.
So those bands come from here, and they actually go up into the toes even. And it's going to be important to know that, and I'll show you just in a minute. So,
are we going to mention also part of it goes up into the calf muscles too?
This is all kind of the posterior chain, they call it.
Yep, exactly.
So, this attaches to the Achilles tendon. The Achilles tendon attaches to the calf, and the calf
right,
to
the
knee.
soleus. We don't have to go to muscles defined.
Right. So what happens normally is this gets torn. This fascia gets torn.
So not like it's torn right off the bone.
No.
Micro tears.
Micro tears.
Very painful though.
Painful, and there's poor blood supply to this, so it doesn't heal very well. And it gets inflamed, so that's the itis. So it's plantar fasciitis.
So inflammation of the plantar fascia.
Yeah. And quite often the pain is right here. It can be anywhere, but quite often I'll see it, and everybody sees that it's right there.
Right, and that's where that fascia connects to the bone. That's where you get the micro tears. But as with pain, the worse it gets, it seems like it spreads out or refers to other parts. And
and also what happens is, that's what is trying to help hold the arch in place, and so that's why it puts a lot of pressure on that area. So the first thing we're going to want you to do is actually, it's not massage, but it's a stretch before you get out of bed in the morning, because what happens is it heals overnight. It's starting to heal.
Yep.
You get up in the morning, you step on it, and you tear it right open again.
Right.
So we want to put a little stress on it, stretch it under control when you wake up in the morning. So what you're going to do is just take your hand, I go right over the toes, and I'm going to pull the foot this way and the toes this way.
So dorsiflex the foot and bring the toe up in that same direction. So you get that stretch. See, because what happens is when you get out of bed, if you don't do this and you stand, all that stretching through your body weight is going on, and very quickly, it's too much too soon. We need to gradually get into that weight bearing.
So, and that's kind of the classical sign. As you wake up, you step, it feels pretty good. Ow, what happened?
As soon as you put weight on it. Yeah. And then you start limping, and then it gets a little better as you walk
usually as the day goes on, right. So what you're going to want to do is do that stretch before you get out of bed, and then put on some shoes so you have some arch support while you're letting this heal.
Right.
And you want to also do this when you've been sitting a while. So if you've been, let's say, sitting for an hour in a chair, you want to go ahead and stretch that foot. Before you get up out of the chair, and again, slap that shoe back on.
That's right.
All right, let's talk about some massage.
Yes.
You can do self-massage with your hand, and you can just do circles with your thumbs, and you can really press in there. Boy, I got dirty feet here, bro.
Oh my God.
Generally, what I recommend is you may not be able to tolerate right over that painful spot yet.
Right.
So you'll want to work around that.
Yep.
And you just make circles with your thumbs, and then you can work into what we call splaying, where you put your thumbs together and pull them apart.
You can do it with your socks on like I do, but it does work better barefoot. I thought with my socks on you can see what's going on because I got a black surface with my white thumbs. But this is something you really need to get fairly aggressive your thumbs are going to get tired.
Yeah.
And that's normal, and that's good.
Well, as a second option, Brad, do you want to grab a massager here? We got lots of different massage options here. All these massage guns, and we got kind of a smaller one all the way up to a large, the most powerful one we have.
Right.
And they all come with 5 heads. This one actually comes with a metal head, too.
Right. You're probably not going to use that
on the foot.
On the foot, however.
Yeah. This one would work really well for that. You want to show how you've been doing this, Brad?
Sure. Well, I don't want to take the time. We got the head on here. Let's get this going here. Now there's 5 settings, and the key about a massage gun is that it massages and it has a linear or a back and forth motion, and that's critical. You're not going to go on your foot straight in. This could
So
be
you're not going in like this.
right, fairly aggressive. You want to go at an angle so that it actually does a cross fiber massage, which has been recommended by Dr. Syriac.
You actually may want to take your sock off.
Oh
on
yeah,
this
that's a
one.
good idea. There we go. There we
Right.
go.
It was
Oh.
recommended by Dr. James Syriac. He's passed away probably 30 years by now already.
Yeah.
But he was the father of orthopedic medicine. Very effective cross fiber massage.
And so I'm doing that without much less effort, and you get a better job done with this. But I'm still, if I get up to that sore spot and it's like, oh, that hurts, stay away from it. Work around it. You know, you can work up in here. You can vary the pressure and use good judgment. You don't want to have the idea no pain, no gain. It should feel like a good massage.
A good pain.
Yeah.
You can bump up against the pain, but don't go into
Exactly.
don't go into the pain cave, as Kelly Stark likes to say.
Yeah, the pain cave. I've heard someone call it the hurt box.
The hurt box.
Yeah. Whoever, everyone's got their own little.
Now, why the massager is nice to have also in the case of plantar fasciitis, we want you to work what they call upstream also, because you want to make sure you're getting all the muscles that are affecting the entire foot. And if this muscle is tight, when you walk, this part of the foot is going to take more stress.
Right.
So this, even the hamstrings, Brad, should be loose enough that they're not pulling and causing tightness and causing increased stress here. So, yeah, you really want to get up into the calf, work that out. You want to maybe even, like I said, get into the hamstring. This is where this one really shines.
Yeah.
I know it's too much for you, Brad.
It
but
is. Now, when I get into my calf, I use a smaller one. It doesn't have as much travel, and I tolerate it because I need to work. And Bob just brought that up. I've got to work on this more.
Yeah, if it's tender, you need work on it.
Yeah.
I mean, if you hit it and there's no pain at all, you're probably fine.
Yep.
Yeah. Like I got certain muscles that are fine, and I got lots of muscles that are not fine. So
And this is the thing about a gun is you can use it all over your body, and other people in your family. We've got Chris. They've got 2 or 3 guns, and between him and his son and his wife are using one now
Chris
too.
is a pharmacist that we have on the channel every so often, and
His son's a hockey player.
Those and Chris is quite active too.
Yeah, oh God, yeah. He's one of
He's
those.
a nut. So
Not a nut case, just
nut case,
in a nice
yeah.
way. He's
All
very
right.
aggressive.
Brad, I'm now going to show the last one here. This is an interesting technique, again, done by Kelly Starr, the author of the Becoming a Supple Leopard.
We still don't know for sure if it's Starrett, not Starrett.
I think it's
How we
Starr.
pronounce his last name.
We'll find out.
Yeah, we're
He's
going to
be on
talk
the
to
show.
him. Yeah.
So you can you put your thumbs right on the Achilles tendon, and you're putting pretty good pressure on it. And while you're doing that, you're actually flossing the muscle.
So you actively move your ankle up and down like this.
And where I feel this is right on there. It really pulls on there. And that means that's bound down a little bit.
Sure, yeah.
And when you do this, you're going to find out your motion's going to improve over time.
See, now, I feel mine more proximal or more up this way. So I've...
You're going up a little higher.
and I do, occasionally when I run, I get a strain in those things. And I need to work on that.
Yeah, mine's pulling right here, Brad.
Yeah. This is I really like this. You don't need a gun. You can do it manually. So, you could do this. I remember I went on vacation once and I had this gun and it was so hard to pack. But now this one's easier to pack. But if you can have options to do it without, that's a great,
right.
great
You
thing.
can certainly work it with your hand too.
You
It's
bet.
just, it begins to fatigue after a while. So.
And probably the older you get, like my fingers just don't tolerate things. I don't know if
Right.
I'm becoming a wimp or I just don't.
Right, it's probably getting a little bit of arthritis, Brad.
Bob, don't say that.
I'm sorry.
Oh, he said it.
All right. Check out this video is a part of a series of videos on
right.
massage. Check out the entire series at bobandbrad.com. Go to the program section.
Right.
Look for massages. Other ones there, sciatica, we have one on plantar fasciitis.
That's right. That's
Yeah.
even giving more detail. We got one on
Right.
TENS units. We got one on the hip that I don't know if it's quite totally
done
loaded yet.
Shoulder.
Do we have the shoulder yet? Whatever, you'll
Yeah.
see. And each section, say
Each video.
yeah, well, there's a section with a number of videos.
Oh, right.
And you go through and you pick out the title that you need to look at.
Right.
And then click on it. You can watch a video. They're about 10 minutes long. And there's a PDF printout that you can get a review of the video with exercises on the printout. That way you don't have to go back and look at the
there's
video.
photos with it, so
Yeah.
that you can, there'll be. We'll have the same thing for this
Are
video.
they color photos?
Yeah.
Oh,
No,
really?
we went all out.
Wow.
And by the way, the cost is what do we charge, Red?
Well, this is a big surprise, Bob.
Yeah.
Completely free.
0.
Not even an email.
Right.
There's nobody else out there that's doing such a generous thing that I'm aware of.
We just want somebody to like us. So
Let's
All
see if
right.
this works.
thanks.